Dr. Robert W. Turner II is an associate professor in the Department of Population Health Sciences and has an appointment in the Duke Aging Center at Duke University. He earned his PhD in medical sociology at the Graduate Center, City University of New York. Robert is also a faculty collaborator at the Maury PTSD and TBI Neuroimaging Lab at Duke University. After attending James Moore Madison University on an athletic scholarship, he played professional football in USL, USFL, CFL, and NFL. He's the author of Not For Long, The Life and Career of the NFL Athlete, Oxford Press, and the content contributor to the LeBron James produced HBO documentary film, Student Athlete. Dr. Turner is a primary investigator for the $6.3 million NINDS funded R01 grant, the contribution of repetitive impacts and social determinants of health to Alzheimer's disease and related dementia in older adult black men. Additionally, he is a principal investigator for the NIA-funded Black Men's Dementia Caregiver Study, co-PI for an R13 grant entitled Black Male Brain Reserve, Resilience in Alzheimer's Disease, Life Course Perspectives, and oversees the Men's Brain Health Initiative, which launched the Men's Brain Health Directory in December 2023. And I actually just met him the first time this weekend. He's been, just a great resource and person to talk to. And so I feel very honored to go and introduce him. And so thank you. Welcome up.
All right. Hello, everybody. Hello. Give him another hand, right? We made one mistake. We said, this is not the last thing I have to do today. Well, you don't know that because Priscilla's still in the room. You never know what's going to happen. Right? Do my slides, do you have them? Yes. Okay, we'll take our, first thing I want to do is, first of all, very much thank you for having me here. And I really sincerely mean that. Thank you so very much. And the second thing we do before my slides come up, anyone in the room who is 25 and younger, please stand up. Please stand up. 25 and in. Let's see. The reason I have you stand up is because I want you to know that you matter to me. Okay? You really do matter to me. You've heard a lot about what we're talking about here. I want you to know that everything that we're saying is important because we need you to carry on this work. Right? We want you to understand you have what it takes to be really special and make a difference in your community. Okay? Thank you very much.
That's right.
All right. Oh. I guess you can't make it bigger, huh? So that's all right. That's all right. We can work with it that way. We can work with it that way. I'm going to start off and just say, I've changed this title. What we're making it today is my journey from the football field to the ivory tower to caregiver, right? And hopefully you'll understand when we go through this. I won't take too long, but I just wanted to share a little bit about myself, and hopefully this is the reason that Priscilla had me come here, right? And the work that I'm doing, it's hopefully we can really work together and do it here. So can we go to the next slide, please? But before I start off, I really want to say, we got to put it in context. Why do black men matter? Why does black men's health matter and our brain health matter? And I'm going to share these slides with you. You'll be able to see this. But some of the things I want you to see that's really important right up front. This slide is about 4 or 5, well, it's about 10 years old now. Since COVID, it has changed. You see up there where it says 70.7 years of black men's life expectancy? Since COVID, that number has reduced now to 67.7 years. So if you're a black man in your lives, on average, what we're saying, we're only expecting them to live nowadays 60.677. That's not good, right? We need you. We need to do, and what are the causes of these things? We're more likely to die from heart disease, more likely to die from stroke, right? 28%, almost 30% of us don't have insurance, which is compared to white men. a great deal. Even if you mix everybody together, overall, we're still higher uninsured, right? Where we have lots of different issues that we're talking about that affect us as black men. Next slide, please. Just further evidence, I do work in the Alzheimer's space, right? But the thing that people want to talk about here that's really, really important, one about, 21 million black men in the U.S. have worse health outcomes than other racial groups. So that means we're very vulnerable, health-wise, right? We've got to, as a community, work together to increase our health, right? And how do we do that? One of the things we're going to talk about brain health today, obviously. Talk about the Alzheimer's. We know that Alzheimer's and dementia is really important to our community. We have a very high prevalence, almost double that of white Americans, right? Well, one of the things we see here, I just want to point out, it says black Americans account for only 5% of clinical trial participation in the U.S. for Alzheimer's and dementia, right? 5%. Think about this for a second. Of that 5%, because we in research, we always say we need evidence. We need evidence. Data is the most important thing. The money follows data, right? Money flows to your communities, through research, it's through data. But if we don't show up in the data, you don't need the money, right? But here's what's the kicker about that 5%. It probably won't really surprise lots of people here. But of that 5%, 75% are women.
Yeah, sure. Yeah.
Which means that only 25% of men, that's 25% of the 5%, show up in research. In other words, we're not there. Right? And what I did once, I'm from Piscataway, New Jersey, and we'll share that story a little bit. Grew up in a place called Piscataway, which is really close to Rutgers. We took high school kids from my high school and brought them down to University of Maryland for them to have a, kind of a career development day. And it was at the School of Public Health. Dr. Stephen Johnson was there, and he said to these men, many of them they're all young people of color. And he said, do you realize that right down the street from where we are is the National Institute of Health? And that's where they make decisions, the health decisions for everybody in this country. Those decisions are made right there. But young men, people who look like you, we're not in those rooms. Right? We're really not in those rooms because we haven't trained them, we haven't put them in a position to have those kinds of jobs. Right? One of the things that's important goes back to this data. Right? So I just want to encourage, that's why it's so important for us to show up. Who's in the room matters and who isn't in the room matters. Okay? So I just want you to really pay attention to those numbers because it's really important. Next slide. All right, so now we'll go on to about my talk. Okay? All right, but this is a quick little bit about me. You've heard in my bio, but I'm a former professional football athlete. Have a degree, PhD in medical sociology. I have advanced training in neurocognitive aging and dementia. Principal investigator on a couple of different research projects, right? Next slide, please. All right, so people ask me all the time, how did you go from being a professional athlete to a doctor? Well, in many instances, I'm like a lot of men in this room, a lot of men in Muskegon and in Detroit. I'm originally born in Newark, New Jersey. My grandparents, part of the Great Migration, moved from North Carolina, wanted to get away from the Deep South, right, and all the oppression that was happening there. In 1920, they were early first wave of the Great Migration. And my grandmother had an uncle whose name happened to be Robert, was living in New York City around that time. And he said, hey, come on, Ruth, you and Major, come on up, and we'll help you start a better life up in New York City. So they got on the train, and like everybody else, they were like, it's time to get out of the South. So the funny thing happened along the way. If you know anybody knows about the training situation up in Northeast, there's a lot of training stations called Pennsylvania train station, right? So when you go to New York, it's Penn Station. But the conductor on the train station at that day said, "You're at Newark Penn Station." So my grandparents got off thinking it was New York Penn Station. Right? But back in that day, literally, we had networks of black folks in every city along the way going up north. So they had somebody that was there that was part of where they're from, in Tillary, North Carolina. My grandfather got a job that day, right, in a ball bearing factory for the automobile industry in Harrison, New Jersey. So that's where my family, set up shop and raised a whole. My grandmother had 9 children, the whole bit. So I am Robert Turner. My dad's Robert Turner, the youngest of his kids, right? And so things were going well. Then you all remember the turbulent 1960s, the riots in the 60s, 68, 69, 67. Well, we had ours in Newark, right? Police brutality, those kinds of things. My dad was very, very strong about trying to stay into the city because we had basically a strong social network. I'm sure you all remember, you all growing up, in our block, it was every uncle, every aunt, every cousin, everywhere. Nobody cared where you were because you were either at your house or your granny's house or your cousin's house where you ate dinner at every place else. You never needed a babysitter because everybody was right there, right? But unfortunately, because of the industrialization, all these great jobs were in the city, as well as the riots, the fabric of those communities started to tear apart. We heard yesterday about the crack cocaine and all those other things. My dad, who was a Marine, was fortunate enough and said, "Hey, listen," he fought that good fight and said, "My kids are not a social experiment. We got to get them out of this environment." So they moved us over to a place called Piscataway, New Jersey, which is right at the foot. Part of Rutgers University's half is in my town there, and the other half in New Brunswick. And so that's where I moved out to there. And at that point, I started playing football and all kinds of sports. And for the longest time, I thought that I really was following sports because I had this love of sports. And I did. But I realized that sports chose me. And I'll share that in a minute. But one of the most important things that my parents did at that time, which is, again, you all heard this story one way or another. But I look back at all the males in my life, my cousins, right, that were all around my same age. We all grew up at the same time. And of all of us, only 2 of us made it out of the 80s without either going to prison, without being addicted to drugs, and those kinds of things. And unfortunately, I have one cousin that was 63 years old just last year. We were born a month apart, and they found him dead in a hotel, fentanyl. Right? So, again, so much of what was going on through all those days, much like today, really attacked black men. I was very fortunate. I fell in love with sports, and I started playing sports all along, right? But I didn't realize until I went and got a PhD, and I was studying this stuff, and I realized that one of the reasons that I chose sports, because in my background, we went from an all-black community to a community that was about 70% white. And then we were also, in the black communities, we were living in redlined areas, so we all lived in the same place. You couldn't go on the other sides of town because you were going to get all kinds of trouble, right? But the one place, I remember the first time that I ever knew anything about racism at all, because I used to think that the world was black, to be quite honest with you. Growing up in Newark, all I ever saw was black faces. The only time I ever saw white people was on television, and sometimes in church. I went to Episcopalian church, and it was mixed. Other than that, my whole network was all black people. Then I moved out to a place and it was all white folks. And so I remember at like 10 years old, I went and tried to play baseball. And I didn't know how to play baseball very well, but it was obvious to me as a young child I was a better athlete than everybody else that was in there, right? But I was the only black kid that was in there. It was me and one other 2 other people. And everybody, we didn't get chosen at 14. I couldn't understand. I cried. It didn't make sense to me. How did I not get chosen? I didn't even know that it was a black and white thing. But my dad said, that's okay. So he started his own baseball team, right? And we beat everybody. He did the same thing in football, beat everybody. Then of course the next year he said, hey, we would like to integrate the teams. And he was like, no, we're not doing that. Right? But also the other thing is I realized when I was in school, myself and many of the other people, young black kids of color, they put us in remedial programs. Right? They would take us, everybody go to lunch, and then they shuffle us off into a little closet. And I said, I don't know what's going on, but I know I'm belonging here. But that was all the messages that they were telling me. That's all I internalized. And so I realized that playing sports, that was the one place they couldn't deny. I was better than everybody else, right? So that's where I learned how to be me. I learned that I could walk around proud and tall because nobody could stop me from that, right? So that's how I wound up really being driven to go to college in the first place. Because I thought, hey, I really want to play in the NFL. And I knew that the only way to get to the NFL was you had to go through school. Right? So I said, and I'm first generation, college, and my town come from blue collar town. My dad was an electrician, Marine, that kind of stuff. He could help me get into the union, but he couldn't help me get into college. Right? I didn't know, I joke people, it's crazy, but when I went to apply for graduate school, I didn't know that you had to go through an application process. I just called the college and I was like, I want to go. Right? And they were like, we'll send you the application process. Really, actually, it was crazy because I called NYU at the time and I said, hey, I'd like you to send me, how do I get into the school? They said, well, we'll send you an application package. And they said, but you're not going to get in. And I said, and that brought up all of these old feelings that I wasn't good enough academically. And I said, well, what do you mean I'm not getting in? You don't even know me. I was indignant. I was like, this doesn't make sense. Here we go again. And they said, well, we get more applications than any other program in sociology. We get about 400 applications, and we only keep about 6 to 8 people a year. And I said, well, I guess I ain't on there. Right, but the thing is, I didn't even know that you had to fill out an application. I didn't know how to fill out an application. You say, well, what does that mean? Well, when I went to college on a football scholarship, they filled out the application for me. And I just went on to school. So I didn't know anything about any of that stuff. I just, went on and did all that, right? But again, when I started thinking about my social connection, my social life, I realized at that point, where sum total of our previous experiences and the people around us, I realized that again, why sports was so important to me and why I had, gone on the path that I had gone on. And the crazy part is, I had no idea that I would ever become a doctor. None whatsoever. And I remember the day that I graduated from college, and my dad and my mom and my grandmother was there. Everybody, the whole family was there. And the coach who had recruited me was there. And my dad, was beaming, his baby boy had graduated, and he said to the coach, he said, my son now can do anything that he wants to do. And I thought, well, isn't he crazy? What is he talking about? It didn't make sense to me, right? I'm just going to go play football. That's what I'm going to do. And fortunately, I was able to, for the next 4 years, 5 years, to go. And you see, I played for the, James Madison University, and I went to the USFL, the Canadian Football League. I played very briefly in the San Francisco 49ers. So, thank you. But I didn't. The things that I didn't know at that time, right? And I actually, you see in the middle, I wrote a book, which was it's called "Not for Long: A Life and Career of NFL Athletes," and that whole book is my dissertation, and that is around the difficulty that so many athletes have in their transition to life after football. And I wanted to understand why that was, because it was very painful for me, because in my mind, I grew up thinking, I'm going to make the NFL Hall of Fame. I'm going to be like O.J. Simpson, the old O.J. Simpson. Who ran through the airports, hurts, had a contract, and bought my mom a big old, everything else like that, right? But for me, my career ended in disappointment because I was what we call in the book. I call it a journeyman. I was if there's 53 guys on the team, I was the 53rd guy that they picked to stay on the team, right? And I remember at one point, I was very, at the time, one of my brothers was incarcerated, and I went to go visit him, right shortly after I got cut. And he said to me, and I was feeling really bad, and he said, "Why are you feeling bad?" I said, "Well, because I never really lived up to what I thought." He goes, "Hey man, people would kill to be in the NFL, and you made it." He said, "It don't matter, but you were there." And that really helped me, with my perspective of everything. The other thing I want to share real quick is that story about my grandmother, which is very important. It's important to young folks, too, to hear this. But my grandmother, unlike so many people that I grew up with, especially in that time in the 60s and 70s and 80s, right, when you're in school, up north, everybody, the day school was done, you were going down south. They put you on the bus, you want to see your grandparents there. Everybody went down south. And I had family down south as well. But we wasn't going down south. My grandmother was like, "Ain't nothing good down south." We ain't going down south, right? Oddly enough, I went to school down in Virginia, and my grandmother said she would never go back to the South. She only went 2 times. Once she made my dad drive her down to see her brother's funeral. My dad and my uncle, my grandfather, they were supposed to stay the weekend. My grandmother, she got so uncomfortable there. On their way down from Newark, they stopped in Washington, D.C. for breakfast, drove down to North Carolina, went to the funeral, and said, "We ain't staying," and they made my dad drive all the way back. For one, my grandfather was, unfortunately, he was scared of white folks, right? Wasn't happening. So the only other time my grandmother came down to the South was when I graduated from college. Because at 9 children, none of her children went to college, and I was the grandchild, the first one to ever graduate. My grandmother was about 5'4", and I learned later that between my grandmother and my grandfather, both of them, they didn't have up to about a 7th grade education. But my grandmother, she put in my hand a crisp, brand new $100 bill. Right? Didn't have a lot of money. They literally, it's a story. She cleaned other people's homes and all this stuff. And she said to me, she said, "I've been waiting my whole life for this day, for one of my children or my grandchildren to graduate from college." Right? Now, why is that important? Because I didn't realize that until she told me that. But I also, at that moment, what that meant to me was education is so important to my family's legacy. Yes. Right? And so I said, I don't know when, I don't know why, I don't know how, but I know that I'm going to go on and go to college, continue to go to college after this. Right? Because I just felt that I needed to really uphold what was important to my grandmother. So, years later, remember, I only went to college to go play football. Right? But years later, I was like, okay, I'm ready to go and get a master's degree because I thought that was the investment to do. And I went and I started studying and I learned about sociology. And the reason I started studying sociology is a good friend that said, "You're always talking about race. You need to go study that in school." And I said, "You can do that?" And she said, "Yes, it's called sociology." I hadn't even heard of the word sociology, but I said, "Oh, I'm going to be a sociologist." So I went to Barnes & got a little book and I read about it, went online and realized that you can't do anything with a master's degree in sociology. So at that moment, in all the infinite wisdom in my life, I said, "Well, I'm going to just get a PhD," right? And that was the decision. I didn't know that it was going to take a whole bunch of time in my life to do that. But I did it, right? So that's what wound up happening. And so, next slide, please. This is how I started my journey at 40 years old to go to the ivory tower. That was, again, not something that I was really planning on doing. I only went to graduate school because I was trying to live the legacy of my grandmother. And I was planning to just go get a master's degree because that's all I knew. I didn't even know what a PhD was, right? But I said, okay, I'll get a master's degree. But then I realized that if I'm going to get it, it has to be something that I can do something with. So I just made the decision to do that. And I went on this journey to go through and started the school. And really, I had no intention whatsoever of moving beyond just getting the degree because I was working full-time. In fact, the decision that I chose to go to City University of New York was because I said, I'm not leaving New York City. I like being in the city. I like being up in the Northeast. This is where I want to be. I'm only 45 minutes away from my parents, so I'll work and go to school. And that's what I did. It took me 8 years to do it, right? But that was what I did. And I remember telling one of my professors, I said, you know, I'm not planning on going any further with this degree. I'm going to go back into the workforce. I said, for one, I'm not leaving New York City to go work in Iowa, right, for $65,000. No disrespect to Iowa or any place like that, but I'm a city boy, right? And he said something to me that, again, these things change your life. He said, hey, listen, you're doing something, you're studying something that's so different that people will pay you a lot of money to pursue this line of work. And I was like, okay, tell me. Right? And so he taught me about this whole enterprise of how to do research, right? How to be a PI, right? Principal investigator, how to do all these things, because I really wanted to understand, again, with my research wind up taking me to asking these questions, particularly about black men in altogether, but about black men, because the NFL is 70% black. Right? College, if you look at the major college football programs, right, even though it's a little bit more diverse, but if you look at the major programs and you look who's on the field, they're all black too. Right? And so I said, okay, I started to realize that health was a big issue. And at the time that I had done my book and I was doing my dissertation, was also, you'll remember, in this area, a guy named Dave Duerson. Right? Played for the Chicago Bears, went to Notre Dame, African-American man, was very successful in everything, but he committed suicide because he was having problems and later found out that he had CTE, had donated his brain, right? And there was another guy in my study who had committed suicide, and then there was a couple of other people that had talked to me about depression, and I thought, wow, here's an issue that obviously is really important. It's serious, and I'm just looking at all these other black men that look like me that were having these kinds of issues, and it was impacting them as they age. So I said, well, I happen to be a black man, and I know a lot of black men, and I see that this is very important, so I need to study this. I also am a former football player, and I know the risks and the dangers, and we all hear about CTE, and I want to understand. So how could I impart, and everything that I did with my thinking was, how can I make a contribution that's going to help members of my community? My community in this instance was a community of former football players. My community is the black community of which I'm part of, and the black men, which I think are very much understudied, and we don't know much about them. And we look at those numbers up there and we see that we have all of these kinds of health concerns. So how can I take the training that I have in order to help make a difference in the lives of those people who I care about? And so that's how I wound up getting into the ivory tower. And again, God has truly blessed me in so many different ways because of the University of Michigan. I mentioned last night how y'all have invested for them to be able to identify people like me and to mentor me. Dr. Perry, Dr. James Jackson, so many people there have really invested over the last 10 years, poured in me the kind of training to allow me to be able to do this kind of work. And the crazy part is when we think about this, I go to national conferences and I do so many of these things, and we talk about, well, how many other black men are there that are doing this kind of work? And we got about that many. Right? And in all seriousness, around the country, it's about that many who actually are studying this kind of thing. On a side note, which was even shocking to me, when I was at George Washington University, I was recruited by Duke to be able to kind of come down and work for them on faculty in the hospital there. And I started looking, and I looked at the numbers on a national level of the number of black men who were associate professors at a medical school in the health sciences, right? And it was like 3. I was like one of 3. And I thought to myself, this can't be right, this can't be good, this doesn't help us at all, so I have to be part of a solution to help get more people involved with that as well. So can we go to the next slide, please? All right, I'm not going to dwell on this, but what's important, especially for the young folks in here, right, is you'll see there's 1, 2, 3, 4, 5, 6 different things, and you'll see up there where it says the Michigan Center for Urban African American Aging Research. That was part of the challenge, mentoring that I had. But after spending 8 years pursuing the master's and the PhD program, I spent another 8 years really doing fellowship research to get training, because I didn't have any training in gerontology and I didn't have any training in doing brain health research and cognitive neuroscience. So I needed additional training in order to be able to answer the questions that nobody else was even asking. So that's kind of my journey that took me through here. Next slide, please. So I just want to take a real side step for a second and tell you, as part of the work that I do, we heard Brother Cooley say a little bit earlier, I run the Black Men's Brain Health Study, right? It's the first study of its kind ever to be funded by the National Institute of Health, that we're recruiting 200 black men, 100 who have formerly played football on any level, high school, college, junior high school, college, all the way up to the pros. And then we're matching them 100 men there, black men 50 and over, and another group of black men who've never played football. And we're trying to understand, because we know all of the research suggests, right? You've probably seen this even in the news, that they do race norming, or they used to do race norming in the NFL when they looked at cognitive functioning and your cognitive performance for black men, and they compared it to white men, and we were always lower, right? And we know that it's not biological, right? But they tried to say there's something going on there that we need to account and adjust for. So my study is trying to understand, we know there are differences, we know that they're not biological differences that create this. What accounts for these differences in our later life neurocognitive function, right? So that's what I do. And then the second thing we do, and Dr. Perry again has been very instrumental in this, but I've been fortunate enough to receive funding from the Alzheimer's Association in partnership with the NFL Alumni Association and several other organizations. I have the Black Men's Brain Health Initiative, and with that initiative, we have a conference that we put on every year. Now I realize maybe I shouldn't have put Ohio State Buckeye up here instead of Michigan. But you all probably know this guy, Maurice Barrett, who tells an incredible story. Right? Incredible. He was a speaker there, and he talks about how he was incarcerated and how his mind is in one place and what he had to go through to relieve stress and free his mind and all of those other things that had led to his incarceration. But one of the things that was great about his story, if you don't know it, please read about it. He's got a book out. But he was committed to 4 years in prison, and he was at a max facility because he had been put in prison for attempted murder. And then he went through a whole kind of process to reform himself. And 2 years in, he was a model citizen in prison, and the judge said, okay, well, we're ready to take you to this max prison, to a minimum prison. And he said, Your Honor, please don't do that. He said, because I found a process here that works for me, that is transforming my life. And if it's not broken, please, let's not try to fix it. Let me do my time here, right? And he's done, this guy, believe it or not, he went from nothing, and he owns 25 medical facilities. He's just a pillar of the community, very wealthy guy, he's doing amazing, young brother. And so he was willing to commit his time to come to our conference to help make a difference amongst all football players and all black men, and setting an example of what's going on there. So that's kind of the level of the type of work that we do through the conference. Next slide, please. The other thing that's so important, and that's why I had the younger folks here stand up and talk, should raise their hand, because we have an emerging scholars program. Because what we've also felt, and we've heard from the sister who's a doctor here, we don't have enough people of color who are in the medical professions. Right? We just don't have enough clinicians, not at all. But we also know that there are 2 factors that are the biggest influences on where people practice, clinicians practice, doctors. The first of which is where they went to medical school, right? Go to school and you stay in that particular area. The second of which is where you come from, right? Because we just heard earlier, she said that I'm committed to going back into my community and practicing there. Right? So we have a program that wants to help young people like Jason and others on that pathway, whether they're a researcher or a clinician, and hopefully in this case, maybe he'll be both, right? Because we know that they care about the communities that they came from, and they want to contribute back. And so we need to be, and this is where I'm really committed, and this is why I'm here, is because we need to be the conduit to help people to be able to go back and contribute to their own communities, right? That's why we do what we do. And I really hope that as all these folks that we see up in here, that, you know, I can't wait to the day that you take the mic from me and talk about how you've been able to do so many wonderful things in your own community. Okay? All right, next slide, please. So I can't stop. I got to build on what Dr. Perry said, but why participate in research, right? Contribute to our understanding and treating dementia in the Black community, right? If we don't have data, people treat it as though it doesn't exist. That's right. You gotta have empirical evidence to say this is what's going on in my community, and this is the help that we need. This is where we need to focus our attention and our money to address that issue. So we need the data, and we don't have the data unless you're involved with studies, right? Right? And for future generations, we just talked about that, building a foundation for better healthcare outcomes for the future Black generation, right? Again, we need to address this ethical issue, right? Empower the community and support scientific investment and advancement. People can't come into your community any longer and say, hey, we want to do this to your people. No. We got too much education, too much information to know better now, right? To say, unless this study does this, we're not backing it in our communities. Right? We have the knowledge, we understand that, we can work together to make sure that we have ethical progress, right? And then enhancing public health, inform public policies and improve health communities, right? Just like I said before, when I was talking about the kids from my high school, we need to help them get into those rooms. We need to help them become policymakers. We need to help them from the community take that knowledge and make demands to bring stuff back to the community. That's right. That's right. So that's what we do. All right, next slide, please. And then finally, leaving a legacy of caregiving. My dad, there, I wear his dog tags. You know, he was a Marine, very proud Marine. My dad was just an amazing man, right? And he had dementia, which was very rare, but he had dementia for 14 years, right? The research suggests that a person average will, after diagnosis, live about 7 years. He lived 14 years, right? My dad's my best friend in the world, absolutely. And I was very fortunate for the last 3 years of his life. For one, I worked at George Washington University. They allowed me to go home working remotely to take care of my mom for a year and then take care of my dad for 2 years together. She had chronic kidney disease and she passed from that, and my dad passed from Alzheimer's. But the hardest thing in the world to do, in a way, was, you know, kind of go on that journey with him. I don't have kids, I've never been married, so I don't know what it's like to raise children, right? But I do know what it's like to honor my dad, my mother, my father, right? And to, you know, I saw my dad go through so many of the phases of dementia, Alzheimer's, right? To the point where, you know, he didn't remember my name, but he knew I belonged in his life. He knew I was really important to him, right? So we would go, and one of our biggest rituals that we would do every weekend or every other weekend, we'd take a Costco run, and we'd get a hot dog, right? Love the big old hot dog. And then he'd get the sundae, the ice cream, vanilla sundae with the chocolate in there, and we would just sit down there. And sometimes I'd talk to him, and I'd say, Dad, you're not saying nothing to me. He said, because I'm eating. Let's have a great old time, right? But I do a research project now that I was funded, the first and only study of its kind, in order to look at Black men who are caregivers of a person, a loved one with dementia, right? An informal caregiver. And so what we did on that, we wanted to understand the role of neurocognitive and physiological stress on these men's health outcomes. And so we're now working, that was very much a community project. We're working with the community now to actually do the write-ups in that. But I can share with you one of the most important things that I learned, and that we did, and that study is both, we did focus groups, it's a mixed method, multi-method kind of study. We did everything from collecting saliva from men, we did surveys for health profiles, we did focus groups to understand the contextualization of their lives. We understood their sleep, health, all kinds of different things, right? So now we're writing that up with the community organizations that we use. We did a faith-based initiative. But there's two things that was really important that, and now I'm gonna leave with you, and then we kind of close this up. But when I was at on the streets in Washington, D.C., at the mouth of a subway station, and I was trying to describe this project to a black man, probably at the time was in his 70 years old. And he said, hold up. He said, you want to know what's stressful? Being a black man in America is stressful. So that very thing should form all of the approaches that we have to trying to understand black men's health, right? That's really important. And then the last thing we really found out, because we had to do some saliva collection with these men. And I had to find a way, because one of the things that kept coming up was, hey, I'm not so sure I want you to take some DNA from me, because I need to make sure that the police can't get a hold of this and start tracking me down. Right. But that's a real deal, right? So that's a real deal. You will never know that unless you're out into the community. And again, all of that really shapes how we need to think about what it means to be a black man, right? So I just want to say thank you again for allowing me to be here. This is my contact information, as you can see. And if I can be of any other resource to you ever, please let me know. But I'm really excited about, again, how this group is going to help that group. All right? So thank you.